Hello, welcome to our Cultural Competency Planning meeting. This is our Cultural Competency Committee. We are meeting today, April 10, 2025. This meeting is to bring awareness and to competencies. And I'll introduce myself. My name is Raven Shepherd. I work with Lake County Behavioral Health as a Cultural Competency Chair. And what we do here is we gather agencies, organizations, community members together to talk about diversity. We also talk about all types of diversity, not just one or the other. It's really good to see you all here. I'm so glad that you're all here today. And so we will go over the agenda, and we will talk about the agenda items. We also have a poll where it's geared towards asking about organizations, how you foster cultural sensitivity in your workplace. It's very brief. It's got about 4 questions. So today is a hybrid meeting. So we're located on Zoom and also at the Circle of Native Minds Cultural Center. And our next meeting is May 22nd, 2025, which we will be planning to have another hybrid meeting. So if you can make it to our next hybrid meeting at the Circle, that'd be great. So we'll go over that a little bit at the end. So I can definitely pull up give me 1 second. I will definitely pull up my agenda for today. Give me 1 second.
Informational, something to let everyone know. The next meeting, I've been told we will be starting to use Microsoft Teams instead of Zoom, as that is what the county has adopted. So I just want to make everyone aware the next invitation you receive for this will be a Microsoft Teams invite instead of a Zoom invite.
So this is our agenda for today. So today is our cultural, it says awareness, but we have spoke with some elders and they would like it to say cultural competency, due to the fact that we've moved further than awareness. We've moved further than awareness to competency. So they would like us to, reiterate the cultural awareness committee to cultural competency committee. So that will be changing. And so today's a hybrid, like I said, it's from 10 to 12. At the end of the meeting, we will add in all who's attended today through the chat. We will go down so if you've identified yourself in the chat, we will probably utilize that information and place it in attendance. We'd like to do a land acknowledgement. What a land acknowledgement is to know whose land we're on. So there was genocide in our community. And so here at the location here at the Circle of Native Minds, we are on Pomo land. This is the Scotts Valley Band of Pomo Indians, whose land we're on here. So I just want to acknowledge that. Some of the things we'll be going over is our cultural competency final plan. We are adjusting a little things with the final plan. We talked about trainings in the past. We're continuing to talk about trainings that we want to see happen in our community. We also recently, I've met with our management team and we talked about bylaws for the cultural competency committee. So that's kind of in the works. Our objective for today is how to create an inclusive plan moving forward, also including an intercultural competency proposal. What that means is for multicultural backgrounds and all of us, all walks of life. We want to make sure all walks of life are included. A lot of times, some of us feel left out, and we don't want that to happen, especially in this committee. And so that's what we want to bring awareness to also. Another thing that we had spoke about before, and we will talk about today, is the tablecloth and canopy colors for the Cultural Competency Committee and a logo. At some point, I think the logo might be in our next meeting, but we do want to, we might take a poll in that as well. to see what colors to utilize for our, when we're tabling and things like that. So this is informational, it's open, we're talking about trainings. So if you have a hand raised or if you want to speak out, you're more than welcome. Just remember to share the floor. Let's see. So some of the discussions that we've had were about trainings, multicultural trainings, which includes all walks of life, having people from different backgrounds, people from different walks of life, LGBTQ plus, people that have grown up in poverty, lived experience, things like that. Single parents, I'm trying to advocate for single parenting. Also, hoping that we can have further discussions on what that's like for single parents and how they may be left out of some conversations sometimes. So bringing that to the forefront also. And we talked in the past about training management on cultural diversity. We talked about that. We also know that with the new administration, a lot of language is changing and things like that. So we'll be talking about that later on as well. Do I hear? Oh yeah, we also have Ron Montez here. Ron Montez is an elder from the Big Valley Rancheria tribe. He is going to be, he has other things on his agenda for today. So I'm going to quickly go through this so he can share. He's our presenter today. And so we will get back to the agenda items a little bit later. He would like to share before he gets off today. So I would like to hand it over to Ron Montez, and he could share about whatever it is he'd like to discuss. Go ahead, Ron.
Duwe Namek Odi. In our Pomo language, that means good morning. Wakshi e Ron Montez. Buchike he Gabenapo. I said, my name is Ron Montez. I'm an elder from the Rock People tribe, which is called Big Valley Band of Pomo Indians. Most of our elders who spoke our language are no longer here. Through COVID and through just age, our speakers are gone. And so it's down to elders such as I. I'm only 75 years old, but I am having to learn. I wish I would have paid better attention when I was younger, because now it's on my shoulders. And we're finding that with our culture here in Lake County, we have some unique circumstances and situations that not many people have dug into our history to know about. And so I've heard from people saying, we didn't know there were any Pomo people still alive. We thought they were extinct. And down to people who are just so amazed that we're still alive and not living in teepees and so on because of the Western culture that has the picture that's been portrayed for Indian people. But I wanted to bring you as a group to an understanding a little bit from our perspective here. We have been in this area for approximately 20,000 years, and it depends upon the archaeologists that would do the testing. So we have some artifacts that go back that far, and our villages were completely all around the lake and up into the hills and mountains. And so this was like an isolated area, and so it had all kinds of food supplies. They had the animals. We had deer, we had elk, we had mountain lions and bears. And so we had fish and waterfowl. And then we had, from all these hills and valleys, we had different types of grasses and grains and also plants that we utilized for medicine and for food. And so it was a pretty pristine little time when we were here, not disturbed. And then there's a fish run, which we call our chai, which people now, the chai are extinct, and the hitch, which is their cousin, are now in our lake. And that was what I was raised on. And it was a food supply that would last us a whole year. that we would gather enough to clean and also to dry. And that was a normal, older, before my time, traditional morning food source was they would gather the acorns and make a mush out of it. And so they would have some mush and a piece of fish. And that was their morning breakfast and evening meal also, unless they gathered different types of plants or greens or tules. Um, then we would have other sources to accompany those food sources there. But what I really wanted to kind of zero in on is that when the Spanish came and took California, they there is this. It's like something that each one of these countries that dominates another country, they come and they place their flag and they say, we claim this flag and everything in this land for Spain or for America or whatever. And so that happened. And so all of the people who lived here before the Spanish came, we also had Russians up north on the coast also. Uh, they all made that declaration, and it is called the doctrine of discovery. And that meant everything in that land they claimed. And so the people had less standing than the host nation who had just taken the land. And so we were treated as less than a human. And we became property, and we became a labor source, and we were exploited. Uh, and we had no recourse. There were no laws governing the treatment of Indians. And so it was wide open to when the Spanish came, they brought in cattle, which ate most of the food sources that we had. They were free range, just roaming around, eating wherever. And then we were gathered up and taken from our villages. The men were, and taken down towards the Bay Area to build missions. And a lot of our women were taken and abducted and abused. And so our family units were decimated. And so the women took on a stronger role of leadership, and they still have that place today. We are a matriarchal society. With that information there was Mr. Vallejo, which town is named after down in towards the Bay Area, who owned property up in the Kelseyville and Middletown and Lower Lake area. And they had a huge cattle ranch, and they built a place for him to live. And then later on, there was some Franciscan monks who came up and built the first Catholic church here in the Kelseyville area. And as time progressed, and then the United States decided they weren't going to recognize Mexico and the Spanish government rule, they took back the land here, and they did the same thing. They said, we claim this land for us, and so we became their property. And there still were no laws at that time. And now we're in the 1800s, 1800s. And we now became more abused because they took the land that we lived on and moved us off. We were just like roaming, trying to find a spot where there were no other people claiming that that was their property, and put up fences. And so we couldn't gather in our places where we gathered our medicines or foods. And then there were no rules um, for our safety. And so if we didn't move away from them, they would shoot us. And there was no recourse. We had no recourse. And so this is not ancient history. This is old history, but it's just 100, 200 years old. And so we are traumatized people of being abused in that manner. And so we have been, when I say we, I'm part of that. I have been involved since my youth in trying to get a voice that the government would listen to, would hear our concerns and help. And it was very difficult for my elders in their time because this was a very racist uh, county. Even all of our times in high school, we were verbally abused and some physically abused. And I've experienced that myself in my lifetime. I graduated in 1968 from Lower Lake High School. So I have a little bit of experience in that. And then for um, having jobs, we were not offered any jobs in other than picking fruit or that type of labor, hard labor, or just labor, picking up trash and other things. There was a big celebration once when my uncle finally got a job with the county, and that was back in the 60s. He finally got a job in the county, and that was the first Native American to be had employment other than picking fruit or walnuts or almonds or anything of that nature. So it's been a struggle for us to have um, recognition that we are here and that we have a culture that was rich. We had our own monetary system, a trade system, a social services system. Our, our we had our own pharmaceuticals about out growing out in the in on the land, all the different plants that we used for the different ailments we had. And our food sources, we had people who were specialized in how to make traps, how to make baskets, and how to trap, how to hunt, how to survive. And it was a community atmosphere where it was like a large family working together to just to have their daily life and the needs of that daily life. And so, because of the the need for property and a different mindset in here, uh, we were um, there were laws passed that we could not walk on these streets or highways or roadways. Back then, a lot of them were dirt roads. And if someone was coming down that road and they stopped to ask us if we had a note, and that note they were asking about is if we belonged to a farmer or a another family, they would have to give us a note so that they would not take us and make them their servant. And the men had to work there for 30 years and the women for 20. We had no recourse. That was it. And it eventually became to the point where the first governor of California said, it is inevitable that we're going to have to um, exterminate all the Indian people. You can find it on Google. And so that was the idea and how we were perceived by the colonial mindset. And so it came to the place where the 49ers came through and they were miners looking for places to find more mine. We had fur trappers coming through. And so the Indians became a nuisance when we were just trying to survive. We're not a violent group of people. And so it was, we were like a nuisance. And so the government had a what would you call that? You could kill like an animal and you could turn in the skins. Well, for the native people, it was okay to kill Native people and turn in their ears, and the government would pay them for it. And so our lives were even less than we were at the beginning of that relationship. So those are the traumas that our grandfathers and grandmothers uh, came through, and then with the U.S. government trying to assimilate Native people into their society, they moved a lot of us off of rancherias and reservations to live in the city. And so we were lost. We were no longer called Indians and no longer eligible for any benefits underneath that title. And then boarding schools happened, and a lot of my parents went to boarding schools. My grandmas and them were they were hiding out. They didn't want to go to any of those type of be away from the land and the place their home. And so a lot of them ran and lived out in the hills. And so there's a lot more history to what I'm sharing with you so far. And this is just a brief overview that because of all of that hardship and the stress and the trauma that our people have been through, there has never been a time for our people, the Native Pomo people here in Lake County, to actually deal with those issues of trauma that was introduced to their grandparents and then transferred to their mothers and fathers, and then transferred now to our generations we have today. So there are many symptoms that we see with Native people, but those are not exclusively, but those are results of this trauma that has never been dealt with and healed. It has never actually even been um, acknowledged. That's the beginning place for healing. So I wanted to let you guys, all of you, know that that is the mindset of the majority of the Native people in Lake County, is that we have had these issues and these traumas that we're dealing with, um, that's been inherent in our families for generations. And so those are some of the barriers that we are trying to cross. And when other people come in, it just causes that that trauma to be pushed back a little bit, because there's so many more needs now of others. And so I just wanted to just remind everyone here that um, be aware and do a little research in it, and you'll find out that the story of California Indians has been a tragic one. There's still a lot of hurting people. Um, there is anything that we have fought, and I've been out to Alcatraz in 1969 when we took that over. And we did that because there was a law on the books that says if there were any lands that belonged to the government who were abandoned, then the first offer should be to Native people. And so that was the reason behind Alcatraz. That land became abandoned, and we wanted to have that as some type of land that we could have for our Indian people. And that was why the occupation started, and that's why it took over. That also then later on included another piece of land in Santa Rosa area called Yake Ama, which means our land, which I got arrested for, and so went to federal court and we won. And so that became our a spot that we could use for celebrations and for traditional um, activities. But anyway, I just wanted to have a few moments just to address everyone here, to let you know that there is a people here who have been abused, hurting, need some healing, and we are standing alongside of any other nationality that comes in here, because we would like to have that same respect that a human being has, that they have some worth. And so we have been fighting for that recognition most of my life. And so I appreciate your attentiveness and listening. If you have any questions, please give them to Raven. I have a funeral to attend now. My cousin passed away. So thank you for your time. Thank you, Raven. Thank you, everyone.
Oh,
Goodbye.
thank you, Ron.
You bet. Bye.
Bye.
Thank you, Ron. That was deep. Appreciate the education.
You're welcome.
Thank you. Brennan meeting, I'm sorry. Sorry, I just wanted to hold the moment, and say thank you, Ron. And I know that there's a lot of people here that are, you know, filled with gratitude and, appreciation that you were able to show up today and share your story. And it's not just your story that you were sharing, you were speaking in volumes, for the pain that's, here in Lake County. And I think that's the reason that we have so many responses of people showing up today, is because everybody may want to learn or may want to be aware of what's going on, or maybe people's walks of lives, they've suffered the same thing, or their ancestors have suffered the same thing, or maybe there are some elders in the Zoom room who have witnessed these types of atrocities or whatever. And thank you, Ron. Does anyone have any comments for Ron before he goes?
I just want to thank you for taking the time to share that information. That was a gift to us.
Oh, you're welcome.
Same here. Thank you so much for sharing that with us. And it just makes me think of all the things that I've heard Lake County community members say about how, you know, specifically around the name change of Kelseyville, how, you know, all the pain is in the past and, you know, how are people hurting from it now? And,
Yeah.
you know, they need to hear things like this. And just even you talking about how, you know, Native folks couldn't get jobs other than picking fruits or vegetables. People don't understand how that affects the Native community today, because you weren't allowed to build generational wealth. And so that could be a barrier to, you know, health, to getting education, to so many things. And so that absolutely does affect people to this day.
Correct. Yes. Mm-hmm.
But thank you so much again.
You bet. Goodbye, everyone.
That was very powerful. He's been wanting to come and speak with the cultural committee for a while. A lot of the last couple of times, you know, like we run into things on a daily basis, like, you know, we end up having the detour. So, you know, it was an honor to have him finally speak for our cultural competency committee. And with that being said, if there's anything that you guys would like to share in closing with that presentation, the floor is open. All right, so.
Oh, sorry.
Oh, go ahead. No, go ahead.
Just with what you were saying in the beginning of this meeting with getting.
Gotta go.
I'm so sorry, Leela.
That's okay.
Hey, the volume is on here. Yeah. Oh, okay.
Oh, this is good.
Go ahead, Leela. Sorry.
No problems. Oh, also, if in case there's folks here that haven't met me, I'm Layla Romero. I am the Health Equity Coordinator at Lake County Health Services. But yes, so what you were saying earlier with trying to get, you know, trainings for community members, I think that hearing things like this is exactly what our community members need. I remember going to the Kelseyville School District board meeting last year where they were talking about how they wanted to do land acknowledgements at large school events, and it kind of just turned into a huge um, debate. But one of the things that uh, a woman went up and said was, why would we do something for like what only makes up 8% of our student population? And that hurt me so much because I just wanted to say, like, why do you think that the indigenous population is only 8%? And that's large for, compared to the rest of America. But, you don't think that maybe it's because of the genocide that has occurred? Like what? So it's, like people, and it's just people, they're not being taught these things that, one of the things that another argument against the land acknowledgement was saying that the school board, their purpose is to make sure that children are being educated, not for things like this. Well, clearly people aren't being educated if they are, saying things like that and arguing against a land acknowledgement. And so, yeah, just I always think that the more we can inform people, the more we can make people more empathetic. And so, um, just that's what just kept going through my mind when he was speaking, was that we need to get more folks hearing this.
Thank you, Leela.
Hello, this
Yes.
is Connie. This is Connie.
Hello, Connie.
I just wanted to express my appreciation for the committee taking the time this morning to hear some of the words that Ron had to say. Um, he's been participating in our Pathfinders group at the Circle of Native Minds, and we've been really wanting to provide a cultural competency training from the elders, contribution to that information that would be presented. Um, and also, I just got through a couple weeks ago in Mendocino County, they held a cultural session over there, which was well attended. I think about 200 people attended, but it was really spearheaded by North Coast Opportunities. And I just want to share this because the history about different organizations is so important, because it, it really reflects on what organizations are doing today. But the short story of it was that a lot of our tribal people, when in 1968 in the early 70s, when CBOs were being, community-based organizations were being formed, um, tribal people in Lake County were very much interested in starting a community-based organization. The short story is that because Lake County didn't have a significant population to be eligible for a community-based organization, the tribal people went over to Mendocino County. The short story is North Coast Opportunities was formed. And it was interesting to me to see, almost 50 years later, that North Coast Opportunities was pushing for the cultural competency training, and they did it um, upon our recommendation, and they had a team working on it. So, like I say, we had a little over 200 people, and I think the information that was shared was really incredible. And they're going to do 2 more sessions, and so I don't remember what the date is, but I just wanted to share that with everyone. What a wonderful experience it was to have people from the community be a part of this learning curve that we're going through here. And I'm really excited about, what the opportunities are going to be for us as tribal people, as we ourselves learn about that trauma, because it isn't discussed very much. But until we start acknowledging that trauma, it can't be addressed. So I'm just appreciate again everyone's time for this. Thank you so much.
Thank you, Connie. Yeah, that's a lot, it's heavy on my heart. Like for a lot of us that are very compassionate or empathetic, we feel each other's pain, no matter what walk of life you're from or whatever. You know, empathy could be a skill, it could be a characteristic. And there's many of us that have that. Developing that was always important for me. I didn't understand how to develop that until I understood what historical trauma was, genocide, you know, the divisions between people, what devices are used to separate us. You know, when I started learning about those things, then I was able to be more inclusive with other walks of life. And you know, be able to understand someone else's path. So that was helpful for me. Thank you. Are there any other comments on any of the things that we've discussed so far? Okay,
I would just like to honor you, Raven, for having an elder speak.
I'm sorry.
I just said I would like to honor you for having an elder speak. That was just wonderful.
All right, so what I'm gonna do right now, switching gears, we're gonna pull up the agenda and then look at some items. Give me 1 second. So I know this is where we left off on page 2, but I'm gonna scroll back up a little bit because I know that the last 2 sessions that we've had with the Cultural Competency Committee, we talked about land acknowledgements. There was, I think early on, maybe last year, I had shared a link how to go to a land acknowledgement. You put in your zip code, and then it opens up to whose land you're on or whatever. So we could definitely do that again, or maybe have the link embedded into the agendas or something like that. But let's go. Okay, so talking about the cultural competency final plan. So what brings us here, right? What brings us to this meeting is a cultural competency plan. It's a requirement per the state, THCS, Health and Human Services. And so I have a little presentation I want to share with you guys. So I'm going to move back to that first part of the discussion. So give me 1 second. Okay, so here, this is a presentation that I had made recently. I was just it's an overview of the cultural competency plan. So we have the cultural competency committee, and then this is the cultural competency committee meeting. So this is where this stems from. So there's something that's called a cultural competency plan, okay? And so this is a framework, guiding principles, things like that. So where does it come from? This is where it comes from. It's to develop a framework of guiding principles and having a commitment to cultural competency and health equity. This is a requirement per the state. So I put this quote here from Dr. Martin Luther King Jr. Of all of the forms of inequity, injustice in healthcare is the most shocking and inhumane. So many of us that work like public health or behavioral health in the communities that we serve, we all know what health disparities look like. We have for a long time dealt with health disparities. So it's bringing acknowledgement to that. So the overview for this CCP is, I can make sure you guys get a copy of this as well, if that's helpful. It stems from let's see, I can go here. Are you guys able to see the new, let's see, oh no, let me stop sharing for a second. So we're gonna go back to talk about where this cultural competency plan came from. So a long time ago, back in 2010, 2011, actually 1999, right? So they started working on, there was a work group for the culture, a work group that started working on cultural competency. This started in around 2010. And so there was criterias developed to talk about culture. And the criterias that were developed in 2010, well, they were modified in 2010, were these. The criterion 1, commitment to cultural competency. Criterion 2, update assessment of service needs. We have a dog barking outside. Sorry about that. I don't know if you hear that or not. Criterion 3. Criterion 3, strategies and efforts for reducing racial, ethnical, cultural, and linguistic mental health disparities. Criterion 4, client family members, community committee, integration of the committee within the county mental health system. Criterion 5, culturally competent training activities. Criterion 6, county's commitment to growing a multicultural workforce, hiring and retaining culturally and linguistically competent staff. Criterion 7, language capacity. Criterion 8, adaptation services. Okay, so like when we talk about the Cultural Competency Committee, this is where the language, the information we utilize is all based on the 8 criterions here to bring competency awareness to what we're discussing today. So it also goes down here, so it gives you more information through here. So if you want to look it up, we could definitely send you guys a link to look this information up if that's something you want to do. Let me see. So here we are again. So that was the first, when it started being created. Okay, and so then we move on, staying committed to cultural competency. So there's like a little poll that we have that we're going to be setting out shortly. It's just like 4 questions asking about like, how do you see culture in your agency, in your organization? And that's part of the number 3 here, staying committed to cultural competency. Like, how do we do that, especially nowadays, like with everything going on and us switching to the BHSA? How do we do that? And so like one of the things that are starting to become incorporated into the BHSA and that have been transforming into culture today is the national class standards. Engaging the workforce from a cultural lens with class standards. We could definitely go over that. And so this is all operated under CCR Title 9, Section 1810.410C4, Class 4 Cultural Competency and Class Alignment. Moving from MHSA to BHSA July 1st, 2025. Right now, we're currently still under the MHSA. And so with that, I'm going to move on. Principal standard, governance, leadership, and workforce. So underneath the cultural competency planning and committee, these are the discussions that we have: advance and sustain organizational governance and leadership through policy, practices, and allocated resources. Recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce. Educate and train governance, leadership and workforce in culturally and linguistically appropriate policies and practices on an ongoing basis. And so those are things to be thinking about when we're gonna take the poll. Like, does our agency utilize any of this information? Is there any cultural conversations in our agencies, organizations? I can speak as the cultural chair for Lake County Behavioral Health, that when we do put things out that involve culture, we also have language. We implement language allocation, like we implement language accommodations. We have things written in Spanish. We've been talking about adding Braille into that, into like our facilities and things like that. So those are things to be thinking about.
Don't forget, we also utilize the language translation lines.
Thank you. Yes, if there's anything I'm missing, please let me know. Because there's a whole lot I know Lake County Behavioral Health is doing, and we do have the language lines. Yes, we do. And we are also reaching out to other communities, like we're reaching out to tribal communities. We're reaching out to Hispanic communities. We're reaching out to African American communities, LGBTQ plus communities. If there's anything that I'm missing, please speak. You could speak up if you'd like. This is a good time for us to open up communication and conversation here. Go ahead, Leila.
Hello. So just going back to the previous slide about a diverse workforce, I know that I've shared the Lake County employee demographics before. I'm going to try to pull it up again real quick.
I could stop sharing if you would like to share.
Oh, sure.
Okay.
Thank you. Let me see if I can pull it up really quick. Here, workforce demographics. Okay. I'm sorry, I've been switching between Zoom and Teams so much that I don't know where anything is anymore. So I'm looking for the share button. I'm so sorry.
Should be bottom middle.
Bottom middle.
Mine's bright green.
Ah, thank you. I had to expand my window. Okay. All right, is everyone able to see that?
Yes.
Okay, so here, when you look at race, it shows that our community members are not being represented in our county employees. So you can see if you look at white, so 75, almost 75% of the county employees are white, but only 69% of our population is white. And so, one of the things that I hear is that our county isn't diverse, but really, depending on what source you look at, like I think I've seen the US Census and it says that our county is only like 66.6% white. So if we're not seeing our county employees, like 1/3 of them being people of color, then we're not being properly represented. But one of the things that we have to acknowledge is that like a lot of BIPOC folks don't have the same opportunities. So I don't have access to the data anymore, but I've seen that our BIPOC population is disproportionately experiencing poverty and experiencing homelessness and a lot of these things that are barriers to getting an education and jobs. So, yeah, just something that I think we aren't really talking about is, the fact that our workforce isn't diverse, like as diverse as our community, but also what the barriers are to that. And I know that behavioral health is working on diversifying their interview panels for hiring. I myself have sat on one, which was amazing. Um, but I'm hoping that we can, create a policy for diversifying our panels across the county. And even one of the things that was brought up as an issue with that is that um, the interview panel has to be someone who is lateral or above the position that they're hiring. So if we're hiring a manager or a director, it's really hard to have that be a diverse panel. But again, we should be looking at the fact that our management isn't diverse, that our directors aren't diverse and representing our community members. So that is a big thing that I've been trying to bring attention to and do some work with.
Thank you, Leela. Thank you very much for that. We've been having a lot of conversations about that as well here at the county. And I'm glad that we are working towards diversifying our workforce. And I'm hoping that we can have that discussion also maybe next time or right now to learn about how other agencies and organizations are diversifying their workforce. For any of you that are possibly in leadership or how you've seen your organization or agency diversify the workforce, that would be amazing. Oh, okay, Mary, yes.
Hello?
Okay,
Yes.
so Mike, I'm curious about the rule that the county has that you have to be either lateral or above in a hiring committee, because that's not the way it works at the college. And we, for our hiring committees, we actually have for different constituencies, not necessarily diversity, which I think would be great, but there's some problems with trying to make sure that that would be fair. But we do have, like, there has to be a union rep, there has to be a classified rep, etc. And I wonder if there's a way to ask the county to look at why they have to have it be lateral or above.
Mary, thank you for that. We can look into that, just acknowledging though that that's a county level policy, and so individual departments don't have a lot of control over the county level HR. But it sounds like Layla, that's something you've been thinking about. So we can focus on that.
What I've heard from a former employee of the county was that if you aren't lateral or above to the position that they're hiring for, you can sit on the panel, but you can't score for and like you're not really part of the decision to whether to hire the candidate or not. I don't.
Well,
Do you know if that's true, Elise?
Yeah, I think that's accurate.
And I guess I would ask this committee maybe to pull some materials together and ask that to look at that, because otherwise it's going to be difficult to ever change the diversity of management across the board.
Hello?
Yes. Go ahead.
This is Connie. I think what I'm hearing is something that was also included in the Mental Health Services Act, where they promoted recruitment of peer counselors. And that's been something that at the Circle of Native Minds, we've been advocating for recruitment of peer counselors, but I guess there's no budget for it or whatever, but that's been a recommendation from the volunteer group that is part of the Circle of Native Minds. And I guess it's something within the county that prohibits that kind of recruitment. So even though it's in the different laws, it isn't applied. You know, it doesn't have to be done. So I think the language in different laws provide for these kinds of opportunities, but in the application, there seems to be a barrier in the application of those kinds of policy level
Well,
recommendations.
I just want to clarify that it isn't a budgetary issue. We're developing our budget. We have added peer support specialists to our budget. So in the sense that culture does represent people from diverse socioeconomic backgrounds and upbringings, we are quite diverse in that way. We have a lot of peers with lived experience in our workforce. We just conducted a survey, and about 30% of respondents in the survey indicated that they had previously received services from our department, and a significant portion of those individuals who responded also indicated they are employed here despite having felonies. And so we are a proud felon-friendly employer. But I think that we're still working out the peer support benefit as well at the state level. And so continuing to implement guidance that we receive from the state around how to build out peer supports in a culturally responsive way. Thank you, Connie.
Okay.
To build off of what you said, Elise, I personally was a peer support specialist. So, you know, I moved up now. I'm a case manager. And so I do know that there is growth possible.
Right, thank you.
Yeah, we'd like to see.
Oh, I think you muted yourself, Connie. I think you muted yourself, Connie. Okay, there you are.
Oh, I was just saying that'll be wonderful to look forward to seeing if we could get some tribal peer counselors. Thank you.
Thanks. Yes, this is a good platform for these discussions. This is definitely what we do talk about. This is definitely why I sit in this position as our cultural chair for behavioral health. And I'd like to say, you know, there's a lot of discussion, a lot of movement, and a lot of, you know, where there's hesitance, where we just got to keep moving forward, you know, and keep having these discussions and keep on showing up. Like, I know that I have had to show up, you know, in several different areas of my life to advocate. And it's awesome to have this platform and to be given this platform to know that we can share these ideas and we can make some movement happen and take some action. And I do see their action being taken. For one, you know, it's taken me a long time to get to where I'm at, but I've also been promoted multiple times to be in this seat. So I honor the seat. I honor working for the county. I see a lot of changes in the county. We can definitely discuss those changes as well. Go ahead, Leila.
Yes, just that I am hoping to create a policy within my department for diversifying our interview panels to better diversify our staff. I'm not sure if behavioral health has a policy on it, but I would love input from anyone from any organization if they have anything, you know, not just on racial and ethnic diversity, but you know, we have a very I think maybe 90% of our staff is female, and so like even just diversifying gender, we have LGBTQ plus staff, which is a little bit more difficult to on a panel. You know, you're not going to just be like, "Hi, I'm Layla, I'm queer," to like when you're sitting on an interview panel, but you know, just trying to come up with a procedure for this. So far, what I've come up with is just having staff self-identify if they, you know, identify as being part of a marginalized population. And that way, just not like looking at staff and kind of saying like, hey, you're not white. Can you come sit on our, interview panel and make our staff feel tokenized? But yeah, I would love to hear how other agencies or departments are doing things, and how to just make even the candidates who are interviewing feel more represented and seen, and heard by a hiring panel.
Thank you, Leila. Mary?
So, the process we have at the college, also, and I'm wondering how it's going to go forward with the present administration, but I've been sitting on a number of hiring committees, and the rule is still the same. For the scoring for screening, we have to we ask about people's experience with working with diverse communities, because sometimes could be just as important as having somebody who is diverse. And the way we score at the college is no other criteria can be scored higher than having experience with working with diverse communities.
It's amazing. So let me know if I heard you right, Mary. You're saying that people can score the highest if they have background in working with diverse communities?
Yeah, well, it's not quite the highest, but let's say you have 5 or 6 criteria. You can't have any criteria, including like having experience with computer programming, be any higher than having experience working with diverse communities. And it used to be that you made a diversity statement. Now it has to be included as part of your personal statement. But we also look for, that whether you have a lived experience or for instance, that I worked at a tribal college for 10 years, so that, and I get to speak about that experience versus somebody is saying, well, I have somebody who's different than me, who's my friend. Does that make sense then? Okay.
Yes, thank you. Thank you. That would be awesome to meet with you, to understand that scoring procedure. So maybe we could implement that here at Lake County Behavioral Health as well or something. That'd be awesome.
I'd be happy to. And then one other thing we have is all of our committees have a EEO rep on them. They are the only committee member that can't vote. And the EEO rep is responsible for making sure that that every every interview is exactly the same questions are asked, exactly the same amount of time given, etc. And we all have to, in order to be on a hiring committee, you have to take the EEO training at least every 2 years.
That's really good information. Thank you so much. Anybody else you want to share about how your agency or organization diversifies hiring and onboarding?
I'm sorry, can you please repeat the question?
Yes, I was asking if anyone else would like to speak on how your organization or agency diversifies onboarding and hiring. Or maybe how you would like to see changes in your organization or agency. Okay. Let me pull up the presentation again. Okay, so yeah, we did talk about workforce. So one thing with Lake County Behavioral Health, we've been recently discussing setting up the bylaws and the policies. I think the policies and procedures follow, correct? And so we are working on the bylaws now, so that we can work towards a better workflow of how we utilize this platform especially, but utilize cultural requirements per the state. Educate and train governance, leadership, and workforce and cultural and linguistically appropriate policies and practices on an ongoing basis. So that's our goal. That's where we want to see some workflow in that, right? And I think workflow has been happening since 2010 per our state. Also, for the county, working for behavioral health specifically, like I do see a lot of changes with the fact that we have began an MOU with 2 tribes to provide therapeutic services and substance use services on the reservation. So that's really helpful. So we're reaching out to our tribal communities. And we also have people know that we have Lavos and we have the Circle of Native Minds. And these are also good platforms to continue providing trainings and things like that as well that are culturally sensitive. Actually, all the peer support centers around the lake, it's like we're actually touching many different types of populations to serve. So I just wanted to say that as well. Which I'm very grateful for. I'm very grateful for as a community member, because I don't know where I would have gotten without a lot of the services that are in the community, both tribal and general community, and the education department for sure. So the power of communication and language assistance. So we talked about that a little bit. And let me see. I did want to give you guys a break because I know it's a 2-hour meeting. We're here till 12. So let me go over a couple more things and then we'll take a break and do the poll and things like that. Or before we go to break, we'll do the poll.
Reagan, I'm so sorry to interrupt. I'm so sorry. This is Melanie. When we go to break, is there any chance I can ask you a question in between?
Oh yeah, sure.
Okay.
Okay. Engagement, continuous improvement, and accountability. Okay, so these are the things that we're hoping to get out of our presentation today and our meeting today. We talked about like establishing culturally and linguistically appropriate goals, policies, management, accountability, infusing them throughout the organization's planning and operations. This is for all of our community organizations and agencies. Conduct ongoing assessments of the organizational class related activities. We did not go over the class standard, which we will go back to. I can definitely show you guys that now. You will have the link after. I guess I should have said this before. Let's see here. This is the national class standard. This is like being implemented a lot. This is like current, and it comes from the criterion that we discussed. So this is the national standards for cultural and linguistically appropriate services in health and healthcare. Principal standards provide effective, equitable, understanding, and respectful quality of care and services that are responsive. Governance, leadership, and workforce communication and language, engage.
Okay. Thank you.
Yes. And we're gonna do a poll real quickly because I do want to send you guys on break. So our poll has 4 questions. Patricia, are you ready to?
Yes, I just got booted. I'm back though. I'm gonna launch it right now.
Okay, thank you.
It should be. I clicked launch. I'm having some real bad connection issues right now, so if you guys can't see it, please let me know.
Patricia, where are we supposed to see it?
It should pop up right on your Zoom.
Actually filled out this poll right before the meeting. Should I skip it to not mess with the data?
Yeah, no, just, you can skip it, that's fine.
Okay, thank you.
If you've already completed the poll, everyone, you can go ahead and skip it.
It is it's the same questions as the survey that was attached to the
Yes.
flyer.
Yes.
Unfortunately for Zoom polls, I couldn't add the part at the bottom, the last question, which was a kind of an open-ended question.
Okay.
It wouldn't allow me to do that, but that is in the survey if people have already done that part.
Okay.
And I'm happy to close the poll whenever whenever you let me know, Raven.
Okay. We'll give them a couple more minutes.
Okay.
Sometimes it's hard to, like, you know, with the devices and stuff.
And if you're like me and having connection issues, I couldn't even tell if it launched when I clicked launch. So
Yeah. Yeah, I'm able to see the cultural competency poll results here. And if you have already completed the survey, do you mind like putting that in the chat, just saying completed survey already or something? Give you guys a couple more minutes. Right, so I'm gonna get ready to end the poll now. Okay, so these are the results. I think it just, let's see. Okay, so my organization fosters cultural humility in the workforce, sorry. 19% strongly agree, 50% agree, 13% neither agree or disagree, and 13% disagree. 6% strongly disagree. All right. So like with one thing I like to look at is like if you strongly agree, strongly disagree, I would like for you guys to take my email and we can further those discussions, because I would like to see how people are doing that, the 19%, how they are doing that in their organization, and their agencies. And I'd also like to see the 6% to see and the 13% to see how they are not seeing that, so that we could begin to implement that. That would be awesome. Do you guys have any questions or comments on the poll? You can raise your hand or speak out, it's up to you. Okay, I'm gonna stop sharing the cultural competency poll. All right. Looks like people have done completed it before. We got into the Zoom, which is awesome. Awesome. So I got like 1, 2, 3, 4. Awesome. A bunch of people did. Okay. All right. Does anyone have any comments before we take a break? We're gonna take about a 15-minute break, and then we'll come back and we'll finish talking about what's on the agenda, and then we'll talk about the next meeting.
I just wanted to ask you, these are some great slides that you have. Was there a link or something that you told everyone about in the beginning that I had missed?
I could have said some, but this will be recorded, so if you guys want to get a copy of the recording, that'll be available after as well.
So the slides are not available through
They
email?
are.
Oh,
Yes.
they are.
Yeah, they're not available right now. After the presentation, I will make them available. Me and Patricia.
Yeah, we'll have the recording and the slides and everything that was shared during this meeting available probably this afternoon before the end of the day.
Thank you.
All right, if no one has any comments, we'll take a 15-minute break. So come back at 11:45. What, 11:40? Yeah, I'm not good with math. Sorry, guys.
I'm gonna go ahead and pause recording while we're on break too.
All right. Hello, everybody. Hello, everybody. We're back. I hope you all had a good break. And so I sent Patricia a copy of the presentation that we're going over right now. And so you all get a copy. And let me go back to where we were. Okay, so what we were talking about was we were talking about the class standards. So the class standards has been created in regards to the criterion, the 8 criterion that's required by the state per agency and organization to operate and utilize with. And so the class, you'll get links in the presentation after the presentation. So what it's asking or calling out for is for us to collect and maintain accurate and reliable demographic data to monitor and evaluate the impact of class on health, equity, and outcomes, and to inform service delivery. Conduct regular assessments of community health assets and needs, and use the results to plan and implement services that respond to the cultural and linguistic diversity of populations in the service area. Partner with community to design, implement, and evaluate policies, practices, and services to ensure cultural and linguistic appropriateness. One second. Create conflict and grievance resolution processes that are culturally and linguistically appropriate to identify, prevent, and resolve conflicts or complaints. So these are a lot of what our discussion at behavioral health we've been talking about is how to implement appropriately and identify and prevent and resolve conflicts and complaints. And so I have been brought into conversations in regards to this and monitoring and evaluating the policies and procedures that are set forth with behavioral health. And this is from 2002, but this is part of the makeup of this is part of the makeup of what has developed the cultural competency committee. So this is where this is a good systematic procedure at all levels. So there's a policy level, the systems of care, of course, but then there's a policy level, frontline practice level, community level, and management level. And so what it's talking about is through our assessments, service planning, care management, service support provisions, are we learning how to identify individual prevention plans related back to someone's walk of life, someone's culture? Are we implementing what works for them? A lot of times when we get to the root of where a client may come from or the background of a client, we're able to utilize and use a strength-based approach and pull out some of those strengths. And a lot of times this comes from culture people often ask me like, how do they get centered, or how do they find culture when they don't have like maybe indigenous roots and things like that. And oftentimes I will share with them, it's kind of simple, but I share with them like, what's your favorite animal? I say that sometimes. I ask people, I'm like, what's your favorite animal? And the reason I say that is because like to get in touch with our favorite animal, it kind of reminds me of being in touch with our spirit animal, to where we can learn how to identify with what those characteristics are. And if you look them up on YouTube or Google or something like that, and look up your favorite animal, you could find that a lot of the characteristics, from an indigenous perspective, you'll kind of align with those characteristics and learn how to identify with your own roots. And why is that your favorite animal? Like, that's important. So anyways, I thought I'd just share that real quick. So frontline practice levels, partnerships with families and youth, natural helpers, community buy-in. So a lot of times when we're talking about like partnerships, family and youth, natural helpers, community buy-in, this is where it gets a little bit muddy sometimes, because people are like, I don't want what you got. Or sometimes people are like, I want what you got, but I don't think you know how to, deliver this. So if we learn what works best for people and we're ready to implement that, then we get the buy-in. We get not just a buy-in, not just checking off those boxes, but we get a partnership. We get to relate to other communities. We get to relate to other organizations and agencies based on our similarities or our collective initiatives. So that's important, right? And so then we have community level, that's what we just talked about, and management level, which is data quality improvement, human resources development, system organization, right? So that's what we're doing today also, is we're gathering everybody. We gathered a little tiny bit of data. We talked about quality improvement. How can we build quality into our organizations and into our agencies? There was discussion about human resource development through policies and practices of creating a diverse policy. So we talked a little bit about that as well. So here it kind of, so what this is, so when you see how it says domains, and I'm sorry, hold on one second. So where it says domains / criteria, the domains are where the criteria originated from. And then it turned into the criteria. So now the criteria is becoming the class standards. And also a reminder, MHSA is changing to BHSA. So how do we move forward with the domains being transferred to criteria, from criteria possibly being transferred to the class standards and implemented in the BHSA? So that's what we're talking about. I think in our next meeting in May, we'll know more about where the class standards are in the BHSA. For now, it's still it's in the works for now. So research on the above 8 domains. So you can definitely research on the 8 domains. You can look it up now if you'd like, or whenever. Researching on the above 8 domains included review and analysis of 17 organizational level cultural competence assessment tools being used in the field today. So this is still being used in the field. When we look back at the domains from 1999 to 2010, which changed into criteria, those are still being utilized by DHCS requirements per counties today. The research yielded a compilation of the 8 significant assessment domains as focus areas for assessing and integrating cultural competence into mental health programs. The domains work to create an organizational model for operationalizing cultural competence into systems. The inclusion of these 8 domains is necessary for a county mental health system to affect change and progress towards a culturally competent mental health system of care in California. So where you see it, it's bolded, organizational values is bolded, and then commitment to culture. So organizational values is from the domains. So everything that's bolded is from the domains. Everything that's written after is from criteria, the 8 criterions of the cultural competency plan. Okay. And so 2, policies, procedures, and governance is update assessments of service needs, which include an individual prevention plan, individual intervention plan for the clients, for the community. And then 3, planning, monitoring, evaluation, and then it transferred to criteria of reducing racial and health disparities. 4, communication, client, family, community, integrative committee within the mental health. 5, human resource development, culturally competent training activities. Community and consumer participation, county's commitment to growing and retaining a multicultural, linguistic, competent workforce. 7, facilitation of a board service array, language capacity. 8, organizational resources, adaptation of services. So Q&A sessions, and I wrote in here the references of the Department of Healthcare Services 2010. I put the resource in here, and the link is in the beginning of the presentation. So the purpose, the Cultural Competence Plan Requirements, CCPR, detailed in DMH Information Notice 10-2. Establish new standards and criteria for the entire county mental health system, including Medical Health Services, Mental Health Services Act, MHSA, and realignment as part of working towards achieving cultural and linguistic competence. So when we're looking at 2010, I'm pretty sure people are asking, why are we going back to 2010? The reason why is there has not been a revision since then from the Department of Healthcare Services, and they are asking in 2002, they have asked us to continue operating off of this requirement from 2010. So speaking up for behavioral health justice, communicate effectively and notice changes and similarities within the MHSA, BHSA. So what that means is to possibly research, like some of us are researching every day, looking at the similarities and the differences and the changes between the MHSA and the BHSA, and where does culture fit into all of that? And how do we move along with the BHSA and culture, our commitment to culture? Effectively communicating involves not only delivering a message, but also resonating with the experiences, values, and emotions of what was shared in this presentation. So one thing I heard Elise sharing was that we are definitely implementing experience with, you know, those of us that have lived experience. We are being included in moving forward, which I fall into that as well. I am a person that has been incarcerated in my past. I did learn how to rehabilitate somewhat in through education, through becoming a community member, a positive community member, sometimes a role model or whatever. And I am accepted at the behavioral health, even with my background. So there was that. So here is another link, LADHS, Cultural and Linguistic Competency Standards from 1999. So there's a link in this presentation where you can go back and look at what was being written at that time in 1999. So up to today, in 2019, there was Assembly Bill AB 74, Chapter 23 statutes in 2019 that was passed. And this is in regards to efforts to reduce disparities in behavioral health. So that's another link that you can look into, and how it falls into place with the class standards and the cultural competency plan. And this is just an overview of what we want 24-25 CCP to look like. And then final tips and takeaways: consistent, strengthen your familiarity. So it's what that means is when we're looking at the cultural framework and the class standards and all the discussion that we had today, for us to stay consistent in having those conversations, researching these topics. There's a whole field on culture, so to stay familiar with the upcoming language, especially with the BHSA coming out, that will be very important. With this administration, we've been asked to not utilize a lot of the language that we are using, which it's striking out a lot of DEI language and things like that, a lot of work that people have put in to DEI. And so we're trying to figure out how to navigate through this administration and work on cultural response without getting a ding for it. But we are operating as is, and we are trying to navigate through this administration. Refining emphasis on the transitions that we're facing and the transitions that are to come. Refining as we go is going to be really important. Timing and transitions, that's important as well. Like when's the right time for us to move forward with our trainings? When's the right time for us to slow down, take a couple steps back, reevaluate, do more research on how to navigate is really important right now. If you have any feedback for this presentation, if you have any reflections on the performance here today, let us know. Are you willing to explore new techniques? Are we willing to explore new techniques? Set personal goals. Like setting personal goals is personal goals on how do we plan on committing to culture still, especially through this administration. How do we set those personal goals to navigate through this administration, or to set goals within our family systems, our community systems, and our government systems? How do we plan to utilize that? Iterate and adapt. So this, once again, iterating and adapting to navigate through the transitional phases that we're going through right now is really going to be important. And then I just want to say thank you. My name is Raven Shepherd, 707-513-7165. If you would like to get a hold of me, that's my work cell phone number. Here's my email also. Do you guys have any questions or comments on the presentation?
Hi.
I just want to thank you, Raven. I've been working with the older adult population, and I like that we have to be flexible, especially with this administration, because I'm putting in a different proposal for the older adult population that still can drive and still get around, because I was first working with the people that were isolating and lonely within their homes. And I came across so many that still drive and want to get out and do things, so I think we have to be flexible, but great job.
Thank you. Go ahead, Caitlin.
Hi, Raven. I was just wanting to ask what the participation was with this committee when it comes to the pit count.
So this year, last year, we participated in the pit count. This year, we did not have the capacity to participate in the pit count this year. So we weren't part of the pit count this year.
Okay, is there any way that we can get connected? Because I feel it's very important. I think that, it's something that is, being connected. And so I just want to support in any way. And I wanted to reach out to you because I know that at our general board, it was a huge conversation about having culture, awareness and competency at our pit count and in our meetings at the general board. So I wanted to reach out to you to see if that was something that we could talk about and getting connected with Tiffany Montiel for Scotts Valley Tribe and seeing if we can reach all the areas that need to be reached.
Sounds good.
I can send you an email.
Okay. Sounds
Okay.
good.
Oh, and then a huge piece too is that I need to ask Pastor Shannon if they have trainings within the pit count training that are also cultural competency, language, and I think that should be incorporated in our trainings.
So I'm this is Mary, that committee actually dissolved. So we need to, you should bring that up. I will bring it up as well, but we have that dissolved when Dolores Farrell resigned.
What was the committee again, Mary?
It was I think it was a cultural diversity well, no, it was the equity committee. That's what it was.
Oh, okay, yeah. So it dissolved. I did see a couple changes in that.
Mm.
But I wonder if
You should bring it up to Bruno that it needs to be reactivated.
okay, I'll make sure to do that at our next meeting.
Mhm.
Equity. Okay. All righty. I wonder if
I was gonna say, based on that, right, you might want to, I guess like what I was talking about, by changing the language and things like that, like we definitely don't want to lose our momentum and all the work that's been done. And at the same time, on the other hand, through this administration, nobody needs to throw themselves under the bus, right? And so like learning how to navigate with the right language, like, you might need to call it something else. I'm not sure if they would want to move forward with the word equity, only because like we're trying to figure out how to utilize language without losing our content.
I think that would be a really great, I don't know if this committee can merge with that as, you know what I'm saying? Like our housing navigators has also been merged with HMIS or maybe our hub. I'm starting to read the bylaws again, and there's some changes and stuff like that since I've come back to the COC, but and then housing navigation, but I don't know. I have ideas, and I just wanted to hop in here, support you and your committee, and then also, just kind of see where that all fits and everything. So we can talk about that with Bruno and bring up that, it's been dissolved and that we need, either equity to be there again or, and to look at maybe making some changes.
Thank you. Appreciate that.
Thank you, Mary.
I know locally in our community, I have been told that, some things have been already getting slashed in our community. So we have to stay aware and vigilant of that. I do see a hand, Leela.
Yes, hi. I'm pretty sure that the equity committee is the reason that Bruno and Scott asked me to join the LCCOC. So I would definitely be happy to help out with however I can. And also, yes, Raven, I've had my health equity grant terminated because they were federal funds. And so just to let you all know, I'm still covered in terms of my salary, and so I'm still going to be doing the work that I am doing. I just no longer have funds for any purchasing or any training. I'm planning a Pride Health Fair in June that I was planning on using my budget for. So I can no longer spend on any of that, but I'm still working on making it happen. And I wanted to also let everyone here know that so I'll be hopefully sending out some planning meeting invitations for the Pride Health Fair. And also, sorry, well, now that I brought it up, I was hoping that we could do something with this committee for BIPOC Mental Health Month this year, which is July. Just knowing that with this administration, I think we need things like this more than ever. And just to let our community members know that we are here for them, that, we exist and that we care.
Thank you, Leela. Yes. Yes, this is a good place to have those discussions and to, take the initiative to take some action. I'm hoping that we can provide, like I and Lake County Behavioral Health can provide some action soon, Go ahead.
Raven?
Oh, Connie, go ahead.
Yeah, I was just going to say, it's been really wonderful to work with the Circle of Native Minds as a volunteer with the Pathfinders. And we've been promoting cultural competency training. So there are some resources out there, and we would like to be able to share that information with anyone that's willing to, to follow up on the cultural competency training, because we've been working on that for a couple of years, and then working off a main cultural competency that was put together a couple of years ago for a statewide cultural competency training. So we have access to that information that, like I say, we used throughout the state of California. So that cultural competency training is there with the Pathfinders group. That's a volunteer group at the Circle of Native Minds. And the Pathfinders have been volunteering there for several years, supporting the Mental Health Service Act program. So I just want to encourage people to come by and visit with the Pathfinders group, because we're very active in promoting cultural competency and training and outreach and engagement of our tribal communities. And then we also participated in the opioid settlement fund planning, and we're pretty much the only tribal reps there at these meetings. So anyway, just additional information that there's cultural competency training that could be provided, and the Pathfinders meet the first and second Friday of each month. So everyone is welcome to stop by. And we meet from 10 to 12 on the first and second Friday of each month. And it's a group of elders from the different tribes throughout Lake County, and we meet on a regular basis. So just an open invitation to anyone who's interested. Thank you.
Thank you, Connie. Go ahead, Caitlin.
So Connie, I put my email in the chat. Can you send me that little snippet of info that you just stated so that I can have that in some notes, so I can also share that information? But I also wanted to Raven, invite your committee to be added to the agenda for our general board COC, so that when we do bring this up to Bruno, that we can also just have you guys there to support the communication and efforts moving it forward.
Yeah, we definitely can work on that. That would be great.
Okay, I will, it's perfect time. I believe that any agenda item that needs to be added to this general COC board meeting, when it needs to be added before a week prior. So I just learned this. So I'm going to go ahead and send that over to Melissa Kopp and then add you guys to the agenda.
Sounds good. Thanks.
Thank you.
So we are going to wrap it up. I know that there's things on the agenda we didn't get to, which is we'll just table till the next meeting. We are working on the bylaws, like I had said. Lake County Behavioral Health is working on the cultural competency bylaws to align with the state requirements. And in that, we are going to be looking for I think we had a couple people that were available for co-chair, cultural competency co-chair. And council, and there's a few other things, a few other positions, I believe. So that's something that we're gonna be putting together, and stating roles and policies, procedures, and all those things soon. Any closing comments? I will see you guys later. You guys have a great Thursday afternoon. Bye.